can you expand on the better health help and kind of explosion of these kinds of apps and quick fixes for mental health that is, I would imagine, quite profitable for some of these startups. But does this have the same level of oversight that, say, uh, traditional doctor-patient relationships have? Like, how have they been able to exploit this as a marketplace? Because it seems quite dicey.
Well, I'm glad to have the chance to talk about this because I think a lot of people don't realize that this is happening. There was some coverage of Cerebral specifically by the Wall Street Journal, and I want to say there was an investigative report by Bloomberg, but it didn't get as much of a press cycle as I thought that it would. And of course, Cerebral is not the only company doing this. They were just the most egregious. So one of the things that happened during COVID, of course, there had already been telepsychiatry, but the kind of sea change in the market had not yet happened. During COVID, the rule mandating that you have to see your provider in person at least once in order to get the prescription for Schedule 2 medication. So we're talking Adderall, we're talking a bunch of controlled substances, right? That rule was lifted for obvious reasons. But this is why there was suddenly this we were all getting ads that were like, do you want Adderall? You can basically have some. Right, like on Instagram, and of course, these are extremely profitable. These are also, it's like not totally clear what forms of data these apps are collecting on us. So, for instance, BetterHelp is currently, there's a class action lawsuit against BetterHelp because the very poor privacy protections that were in place for what is, an important medical encounter, and so. There's a movement right now, as you can imagine, from these companies to lobby, for instance, to keep the rules that were instated for COVID in place because a great deal of the profit model depends on those loopholes. I think people should think very seriously about that. But so that's wrong, right? We know that's wrong. But in another sense, and maybe in a more global sense, and this is not to indict any of the very hardworking and well-meaning and often heroic medical providers who are working on these platforms, albeit in an increasingly kind of gig economy model, which results in degradations in quality of care. This is not to indict them at all, but just to say it's not totally clear that this is the type of thing that is going to really make a serious difference with population levels of mental and emotional distress.
And, what you brought up the pandemic, it really is striking how in the United States, this is a bit of a tangent, but our level of vaccine hesitancy was so much stronger than other countries that have a track record of providing socialized medicine and subsidized medicine from their government, where preventative care is encouraged because it's not, going to cost you $1,000 if you're going to go see your doctor, or $5,000. There is much more of a holistic, and I don't use that in like the lavender oil sense, but much more of a holistic understanding of one's healthcare because of the profit motive for at least much of the profit motive being stripped out from underneath that. And that could apply to the way that the US relates to mental health care as well, potentially.
Yeah, I mean, that's actually a good point. I haven't heard made anywhere else that in connection to vaccine hesitancy. I think that's very plausible and smart as a take. I think also, though, one of the things I'd like to encourage people to think about is, so it's not that I'm saying that we live in a society and therefore, if we just like ended capitalism, that everyone's mental health would be better, right? This is kind of pie in the sky, too idealistic to really be useful for people who are, experiencing very real suffering right now. But if we want to be serious about solutions and thinking about concrete possible solutions, we need to reframe the problem such that the solutions that occur to us are different solutions. So, if you think about the amount, Biden's mental health care plan proposes to establish a series of hundreds of behavioral health clinics. And, it's not that I think that that's a bad idea. And it's not that I want to say there's some sort of scarce amount of government money that should go to this or that, but we also have to think like, okay, what about housing support? What about public transportation? What about things like, addressing food insecurity for people? And these are very real problems that impact mental health, right? And so what I am suggesting is that just because a problem manifests in the body does not mean that the solution to it needs to be medical care, much less medical care that is transacted through this highly individualistic, extremely for-profit way that American medicine works.
Yes, and that brings us right back to the thrust of your piece, which is something I couldn't agree with more, which is targeting the source of some of the generalized stress and thus anxiety that it has kind of ballooned in society, which is one that is created from insecurity of food, poverty, discrimination, capitalism more broadly, and then especially in the unfettered neoliberal model that our government has adopted. And I mean, just can you talk a bit about how alleviating those stressors of housing and those kinds of things and making people just actually able to live a comfortable life, especially when we're the wealthiest country on earth, could be perhaps the most efficient way to actually target mental health without atomizing it, in particular by atomizing ourselves and thus medicalizing it and making it distinctly medical.
Yeah, so I think this is a good time to reiterate that my position is not one of the anti-psychiatry movement that you may remember hearing about from like the 1970s with like Thomas Zaz, R.D. Laing, even Foucault to a certain extent, that held, in some portions of the movement, held that mental illness was completely fake, essentially. It was completely constructed, that there was no biological reality to these diseases. That's not what I'm saying. But when we talk about what kind of a disease is a mental illness, mental illnesses are categorized using a system called the Diagnostic and Statistical Manual. And the Diagnostic and Statistical Manual, or DSM, became prevalent with its third publication in 1980. And what you need to know about this is that there was a big fight going on between people who had a sort of psychoanalytic or a psychodynamic orientation, so like, the therapists, and the psychiatrists who are trained as medical doctors. And the medical doctors, of course, want to reduce everything down to like, this is the biological illness in the same way that breaking your leg is a biological illness, and we're going to find the causality that works through like neurotransmitters, right? And the psychodynamic people were not so hot on that idea. So what emerged from this power struggle was an agreement that, well, we're not going to really posit causality in these diseases. What we will say is that these symptoms tend to cluster together. And we're going to say, like, because these symptoms of, for instance, like depression, so like weight gain or loss, sleep loss, feelings of fatigue, feelings of hopelessness, whatever, we're going to just say that that's a disease. But there's actually no guarantee that at a neurobiological level, or at a if you put someone in a scanner, or if you like take their blood or whatever, that there's a biological basis for the entity of depression. Now, I'm not saying that there's not, to this extent, that any mental state corresponds to some sort of biological state. Of course, there's a correspondence, but we're not talking about the same kind of thing as tuberculosis, where there's a well understood pathophysiology. In fact, if you talk to any leading neuroscientists in the field, they will tell you at a neurobiological level, at the level of having figured out the biological basis for something, depression is not a meaningful concept. And same goes for anxiety. I mean, I'm talking about those two because those are the two most commonly diagnosed ones. And so when we're thinking about like, what is the biology of these disease entities? Well, these are not disease entities in the same way. And so, the idea that you can just take a drug or that there's some sort of well understood medical intervention that is going to just address this because it's a disease in the same way that tuberculosis or typhoid is a disease. This is just not scientifically true.
And it's a tricky kind of tightrope to walk, because you don't want to speak to somebody and say, well, your depression is societally caused in particular, or it's not a disease for you, because it is. It's just, in the same way that maybe that frankly poverty increases the likelihood of other diseases, in the same way that living in an area near a plant that is giving off some sort of emitting fumes that are toxic might increase the likelihood of some kind of disease, right? You can I think that there's a bit of a in the same way we've spoken about this on this program, where like economics should be seen as one of the branches of understanding society, much like sociology. You see them as a whole, but economists kind of feel that like they're scientists and their view is exactly the way things are. Putting mental health in and medicalizing it, and thus cutting it off from all of the other intersectional just realities of what goes into mental health, it's almost in the it's kind of in the same vein, right? Where this is scientific and unchallengeable, and then there's no real end in sight, because you're not effectively combating any of the underlying problems.
Yeah, I think that the toxicity metaphor is a really good one, or analogy there, because if you think about if there's a nuclear waste dump near your house, and then you see, of course, in your community, you're going to see elevated levels of cancer, right? It's not saying, it's certainly not accurate to say that cancer is not a biological problem. But if all that you do is treat the cancer without addressing the toxic waste dump, you're going to continue having cases of cancer. Now, the analogy breaks down there, because our treatments for cancer that are available currently, given this sort of state of the art of medical care, are much more effective than the treatments that we have for mental illness. It is a fact that if you look at an aggregate at clinical trial data and what are called meta-analyses, or basically analyzing many studies at once, treatments like SSRIs for depression tend to not operate very much better than placebo. That's not to say that they don't help some people, and it's not to say that they don't address a sort of biological reality for many people. But the reason for this is that we're lumping too many things together under the same name.
Right. Like SSRIs work for people that it work for, but when the umbrella is way too large, then how do you even know where the effectiveness lies, right?